Hi guys, I see you all are joining. We're just waiting for the doc to join in. Oh, there she is. Oh. She should be joining here soon.
Hello.
Hi, how are you?
Good, how are you?
I'm doing well, I'm doing well. So question, do you have headphones on?
I do, yeah.
Okay, perfect. So I don't hear any feedback, so I think we're good. So I'll
Okay.
get started here. Okay, this is Dr. Nkeiru Orajiaka. She is
Yeah.
your pediatric ER doc, right?
Yes,
So,
pediatrician, but I only practice in ER, yes.
okay, so explain what that means, number one, what you do, and then also talk about where they can find you on social media.
Okay. It means I am trained completely in pediatrics, 3 years of residency, but I work primarily in a Columbus, Ohio emergency medicine department, which means I see anything that walks through the door. I don't see a lot of trauma cases all the time, but anything that walks through the door from newborn to 21 years of age and and whatever walks into the door. That's what
Yeah,
we see.
pretty much everything that walks through the door, I can imagine. Yeah, yeah.
Uh-huh. Yeah.
And then where
So
are you on social media?
I am mostly on Instagram, but also on TikTok and Facebook. And my Instagram and TikTok are the same thing. It's Doctor underscore N, which is my first name, and then last name Orajiaka for both Instagram and TikTok.
Perfect. And I just had a conversation yesterday with Dr. Chinedu Nabubi, who is an MFM specialist
Yeah.
out of Columbus as well, in Ohio. Are you in
Yes.
Columbus too? Yeah, you're in Columbus too.
Oh,
So
he's in Columbus. I didn't know he's in
he's
Columbus.
in Columbus. Yeah, yeah,
Oh,
yeah,
look at that.
yeah,
So
yeah. He
what? I
is.
should probably reach out. I just
You
saw the
should.
live yesterday, but I'd
Yeah,
never
yeah, yeah,
met him.
yeah.
Yeah.
I'm not sure exactly. I know the hospital. I can't think of it, but yeah, I'll connect you two. So maybe you guys, I don't know, may know each other from something else.
Yeah.
Okay, so
Interesting.
let's
Yeah.
just start off the top. I was a new parent once to twins. Many visits to the pediatric. Many. I mean, you would have thought that I had zero medical training, but actually, I was not the type of parent with a medical background that assumed anything. I acted like I did not know anything because I did not want to assume that I knew something I didn't. And I was so scared to miss anything or assume anything that everything I went to the urgent care, the pediatrician's office. Okay, we're just going to start simple. Why do parents, especially first-time parents, freak out so much about bathing? What is it about bathing? And you can include in this what you're talking about as far as the umbilical cord care, since it's kind of all ties in together for those first 2 days. Why are we so petrified of bathing our babies?
So I think it's actually two different schools of thoughts.
Okay.
One, some people believe that once the baby comes out, they're too dirty, you have to bathe them. But it's changed over the years. Now we want to hold on to the mommy baby timing to room in. And we always say like within 24 hours, you don't have to bathe them. They're not dirty. You can wipe them down. But within 24 hours, we want them to be hugging and loving on their parents. So no bathing at all within 24 hours. So after that, you don't even have to do a lot. Like, what do? They basically feed and eat. They're not sweating. They're not rolling over on the mud. So you don't have to do a lot when it comes to bathing. And I think the other thing is that people or baby families are always scared that their baby is going to get too cold or maybe get too hot when they expose them. So that's about the only thing that freaks around with bathing. And I think another thing is, I think because they see them as being too delicate, not every parent is comfortable holding the baby yet. So it's about finding the position that's more comfortable, making sure your baby doesn't slip out of your hand before you bathe.
Mm-hmm.
So I always like think about like so one, outside the 24 hours, you can do what we typically recommend is what we call sponge bath because they still have the umbilicus or the umbilical stump. As long as it's there, if you soak them into water, it keeps getting moist and it takes a longer time to heal. So you just want to leave it alone and do sponge bath, which is basically you can put a towel down on your changing table or on the bed, and then just take water and cloth, clean cloth, and maybe a little bit of soap, and just wipe them down. And you can cover, use a towel and cover them and clean as you expose. Let's say you're
Yeah.
cleaning the head, you just like clean the head and expose the belly and just kind of go down. And that's what you do. And when it comes to the umbilical stump, before we would say use alcohol and hydrogen peroxide and all those like funky stuff to use and clean it. It's not recommended anymore. You can just wipe it around it with like a clean cloth and just leave it alone to dry out. And when it falls off, you can now do an actual like soaking your baby for them to enjoy the water and like a very steady bath that will not slip off or have the baby slipping off. So that's about the only thing about that.
Yeah, because I think about when I deliver a baby. I mean, you manhandle a baby deliver. I mean, and you know, then we hand it off, and then after that, it's like they're little glass china dolls. But you know, babies, you know, as long as you're supporting their head and their neck area, I mean, they're pretty hardy.
Yeah, yeah.
But I felt that way too as a new parent. I was like, if I touch them, they're going to shatter. I was so scared. But yeah,
Yeah.
so the basic rule of thumb is a minimal intervention on the umbilical cord. Just keep it clean and dry.
Clean and
Maybe
dry.
just using water, wiping off around the skin area with maybe just a baby wipe or a water wipe. And no submersion baths or putting water until after the umbilical stump falls off. And how long does that usually take?
So some people between 7 to 21 days. Some are longer, some are shorter, but
Yeah.
between 7 to 21 days. Yeah.
And then
And it
after
just
that,
dries up on its own. Yeah.
yeah, and then the temperature. Is it true? And you know, this is what my parents taught me: is that you test with like the palm, like your hand or the back of your hand, the temperature of the water to see how it feels before you put the baby in. Is there a certain way to make sure?
Yeah, so I know there are thermometers which are fancy, which you don't necessarily need. Actually, the elbow, that's the safest place that actually mirrors the skin of the baby, the elbow, and then the wrist. The palm is not as sensitive, and even the back of the hand, maybe a little, but it's not as sensitive. You might not be able to tell the temperature of the water with that. So we stick with the elbow and then the wrist. That's the most convenient place or the safest place to know how warm the temperature be. Even for your baby's formula too, if you test it on your palm, it may not necessarily tell you how hot it is, but like that's what we do, like the wrist and everything else for that.
I got it. Okay, so let's jump into what is this thing about the newborn period? What is a newborn period? Or newborn
So
bleeding?
that's one thing that I know. Oh my gosh, I've had a couple of parents come into DD like, who touched my baby? What is going on? Why am I seeing this? And it's understandable if you've never seen it before, and all of a sudden you open the baby's diaper and you're seeing blood. That's really concerning, but that's completely normal. So that happens, like, you know, the baby has been there for like probably 7 to 9 months, depending on how old they were when they were born, and there's a whole lot of hormonal exposure from the parent. And as once the baby is born, the hormone gets cut off. So that's like the effect where it starts to wean off. And for some babies, you may just see vaginal discharge, or you may see vaginal bleeding, which is basically a few drops of blood in the diaper. It typically happens between like day 2 to 10 and may just last 3 to 4 days. So we're not expecting to see like a heavy period. You're going to need tampons or pads. You should not be seeing that. But it just lasts a few days and then disappears. So that's what we call, it's not an actual period. It's called like false menses, which is people describe that's the first period the baby is going to have before they get to puberty. But it is always scary, but it's normal.
But it is normal to have. Gotcha.
It is normal.
Okay,
Yeah.
and here another important thing is urate crystals. What is that?
So again, with respect to exposure that the babies get through the placenta, they have a high, what we call uric acid, which is one of the components of the body. They have a high uric acid level in the body, and they pass those uric acid through the urine. So when they're urinating, the urine it just comes out. But what happens is for some babies, it may what we call crystallize and become thicker, and you may see it as like brick dust or appears like orange in the diaper. So it happens more in babies that are breastfed versus babies that are formula fed, only because with like colostrum and everything kicking in, the babies that are breastfed, you may not know how much quantity they're getting versus those that are formula fed. So, and what you want to watch out for, one, it's normal, but it happens, you don't last between more than 3 days. If it's lasting longer, we start getting concerned about babies who are dehydrated, because it means that the urine is more concentrated, then the crystals are going to get more, but it just appears like orange or like break on their diaper, and it's completely normal. So you just have to watch for how much is your baby taking, how much are you seeing of it, how long is it lasting, and then just kind of follow up with your pediatrician to about that one.
Okay, okay. Now, there was a video on TikTok recently that showed that a baby was lactating, had some milk coming from the nipple. Is that a real thing?
It is a real thing,
Okay,
yes. I went through the comments of that video and it was
okay.
interesting. I
I'm
guess some people
sure.
were saying she
Yeah,
some
I was
people are like,
like,
oh, pray for the baby. Yes, it
yes.
is normal. And it's about it is it's all related to the hormones too, which is exposures. And most commonly, you may happen just about 5% of babies, not a lot of babies. You may notice some babies have like enlarged breast buds, so you think your baby is having breasts at birth. That's one of the things most people see.
Yeah.
But then some babies actually go ahead and lactate, and you're seeing milk like flowing out. You're not expecting it to be spraying completely, but it just kind of flows out of the nipple. In most cases, it resolves on its own. One, it may last within like 1 to 2 weeks. Some others may last, they said about 1.8% of babies may last up until 2 months and
Mm.
then resolves on its own. But one thing you want to make sure is you're not pressing and massaging it. That's what people think when you press on it, you're going to
It makes
make it
it
smaller.
stop. It probably
Yes,
makes
it
it
is
worse,
not.
right? Yeah.
Yes, it does. It makes it worse. And also because you're touching the nipple around you, they can actually get infected and get what we call
Yeah.
mastitis.
Yeah.
So you don't want
Okay.
to massage it. You can just kind of leave it alone and talk with your pediatrician. One thing that one of the one someone mentioned was you can also have some brain tumors which cause like increased breast milk. So if it's lasting more than 2 months, you probably want to get that checked out by a hormone doctor. But it's normal to have that too.
Okay. Okay. Yeah, I had actually never heard of that until I saw TikTok, and I was like, I'm gonna ask her that because I am not sure. Because sometimes you see things on TikTok, you're like, is it real?
Yeah.
Is it not? And you have to question it, but no, it's real.
Yeah. Babies
Okay.
are interesting. Yeah.
Yeah. We are talking. Okay. So the whole thing with pooping, I remember I was petrified and so paranoid about one of my babies, or either both, being constipated and me not realizing that, because I heard constipation in newborns is an awful experience. So talk a little bit about that. How would you know that your newborn is constipated? What are some of the signs, and then what can you do about it?
Okay. So before we talk about the constipation, we can just gonna come from what the newborn poop typically looks
Sure.
like. So
Okay.
the first one is black, which is what we call meconium. And we always want a baby to pass the meconium between 24, 36 hours because we want to make sure they don't have anything called like Hirschsprungs in the future,
Yes.
because we want to make sure things are moving. So the first poop should occur within that time, and it's always black, maybe one, two, three of it, and then subsequently moves into getting like greenish or like yellowish seeded stools.
Mm.
Within the first week or 2 weeks, babies they feed, they poop. So they may be going between like 2 to like 10 times a day, like little seedy tube. That's okay.
Mm.
As they start to get towards 1 month, they may change their pooping patterns only because they're getting older, their GI system is developing. So that you may see babies who've been pooping like 5 times a day, going maybe like once every three
Mm.
days. And
Mm.
that's always very concerning for families because what's happening,
Yeah.
they're not pooping anymore. But I always tell them, yeah, look at it as you're saving diapers.
Mm. Yeah.
As long as the baby one is not vomiting, as long
Mm.
as when they actually take some time after the couple of days and poop, it comes out soft. As long as the baby is not like too full and hurts when you touch it, it's still okay. Babies can go between 5 to 7 days. Even some can go 10 days without pooping, although I always recommend have your regular doctor check on that. But when it comes to poop, you want to make sure one, it's soft, it's not white, there's no blood in the poop. Those are all normal. When we start talking about constipation, so there's also something called infant dyschezia, which means babies strain and turn red and look
Yeah.
super upset, like they want to poop. And then when it comes out, it's soft. It's only because like they haven't really coordinated the mechanisms of pooping. They're
Mm.
laying down to poop, so they were uncomfortable. But that's like it's not constipation. Constipation means one, they are passing stools that are hard and dry and uncomfortable when it comes out, not just
Mm.
about how much the strain. That's what constipation is. It may be between few days to a long duration of time, but the duration is always different per baby. But we always focus more on what the stool looks like versus how uncomfortable or how they're strained to go.
Yeah, yeah. Yeah, my daughter never had an issue, but my son did. And
Yeah,
there was a lot of time spent working that out. So I get it.
yeah,
It can be very distressing because, like you said, their poop. patterns do change. And when you're used to seeing poop every day, and then you next thing you remember, like, oh no, when was the last baby diaper? Then you start checking the logs, and because we wrote everything
Yeah.
down, and you're like, oh my God, it's been 5 days, and but I mean, they were never. He got a little uncomfortable with it, and you could tell. But he was more of a gas thing, getting gassed. Well,
Yeah.
let's talk about that. You hear about the drops that you put. What are they called?
Gripe
For
water.
yes, gripe water.
Awesome. Yeah.
What does that do, and how do you know when your baby might need it?
So, I did a post a while ago about gripe water versus simethicone. So gripe water actually does not do anything.
Yeah.
The origin of gripe water started with probably back in the 1980s or like in the 80s, where they will use alcohol and sugar. And the relief that babies got from gripe water in those days was from the alcohol and the sugar. So now the one that's here now has a whole bunch of like maybe oils and like things that are maybe like what they call like fennel leaves and all that. That's supposed to help, but it's more of placebo. When we want to recommend something, we typically do simethicone. It's more anti-gas compared to gripe water. And one thing I wanted to note is for anyone watching this, especially like in Canada, they still have gripe water that contains alcohol, which babies are not supposed to get. So you want to check the content and make sure your baby's not getting gripe water from alcohol, because that's what gives them the real. They pass out and they sleep, which you want your baby to rest, but not with the one with alcohol. So gripe water, I mean, we're a little bit here and there with it. Simethicone works for like anti-gas, but it also depends. If your baby has colic, it's more about what we call the soothing techniques, the bicycle techniques, swallowing them to get them in relief. Simethicone may or may not help. We're not completely averse to trying it, but it's not like antibiotics that will solve your problems completely.
Okay. Now let's get into the topic of sleep. I want you to go first with the ABCs of sleep and why, the Back to Sleep campaign is so important. But I do know, and this is a huge argument continuously on social media. I'm sure you see it because parents do co-sleep, and there are some that are very, they advocate for it. Even some physicians I've seen say it's okay. And I know the AAP just came out, or not just came out, but did came out, even though they don't advocate for it and they still advocate for the Back to Sleep, they did put out some, some guidelines regarding co-sleep to try to make it safe. So first, let's talk about why sleeping on the back is so important, and then what your thoughts are on co-sleeping.
So when it comes to ABCs of sleep, says alone, on the crib, on the back, on the crib, which means nothing in the crib, no pillows, no unless you're swaddled, no blankets, nothing at all in the crib. And this is because over the years, studies have been shown that babies, because we always used to put them face down, but babies cannot turn their head. They end up suffocating because they can't breathe, or maybe strangulating with things like the blankets or things around their bed. So that's how the ABC of sleep started, because we know the crib, it's a firm surface. It's not like what we call a mattress that deeps, because if it's a mattress that deeps, they will put their face and they get stuck. Exactly. So that's the whole idea of being on the crib, which is a firm surface. On the back, because like we mentioned before, they can suffocate, and alone, because there's nothing that increases their risk of suffocation.
Yeah. Well,
so when it comes
there was recently a story, it wasn't a newborn, it was a baby under 1 that had a blankie. Nothing else, just a blanket, but somehow the blanket got wrapped in the railing and the baby got wrapped in the blanket and the baby suffocated. So something as innocuous as that, even though it was a little baby blanket, it still happened. So it's so important to understand the reason why, right? That we don't want anything in there, because even if it seems like it can't happen, it could, and they're not strong enough to get out of that. Is that what it is? And their faces are so squishy. They got big cheeks. They're getting squished. I mean, it's so easy to, and especially at that time, they're mostly breathing through their nose. They don't necessarily know to open their mouth to breathe, and that's how they suffocate. So you have to look at all the contributory factors to why it would be so easy for an infant, and especially a newborn, to suffocate in those situations. Is that right?
Yeah, completely. All of it is correct. And especially, I think the other thing people kind of forget is the cords, the baby monitor cords. Cord blinds, baby not want to, make sure it's nothing. Because I've also seen a baby who started rolling, and the cords from the monitors and the blinds just kind of wrapped around the neck. So we always have to be careful about that.
Yeah.
So when
So
it
yeah,
comes to co-sleeping,
yes,
so I
co-sleeping.
think that's a completely different conversation. It's a very difficult conversation. Like
It is.
I did co-sleeping for my first child before I even became a pediatrician. I had no clue. Of course, it's like my mom grew up doing the same thing. So I'm
Yeah.
like, what's the point? It's like we're just survivor's bias. I made it through.
Yeah.
And then of course, there's a couple of year gap between my first and my youngest one. I was like, what did I do? I mean, I'm
Mhm.
like, this is not even, there's no say for me, there is no safe way to do co-sleeping only because my emergency perspective, I have seen parents come in with babies dead. I've seen enough of that to say, I don't want to wait for that to happen to someone else for me to start recommending, like, this is how you can safely go sleep. In residency, I had a mom, this was our second child that was happening again. And I cannot have that mindset and say, hey, this is how you can do it safely because I just don't know how to explain it. And I
Yeah.
know it's like different thoughts for like different people, like Docker thought on the bed, garden. It's just does not, there's no
Mhm.
safe way to go sleep. That's just my perspective.
Yeah, and I agree. And what you mentioned was very important because I actually saw a social media video about survivor's bias in parenting. How and they didn't use co-sleeping as an example, but co-sleeping is an example. Well, I did co-sleeping with my kids and I'm fine, but that is survivor's bias. And you can have the luxury of having survivor's bias until you don't. And
Exactly.
but we're not here to tell people how to parent. We're here to educate and give what the guidelines are, what the recommendations are, and whenever, and just for an example, when something like the AAP, the American Academy of Pediatrics, comes out with guidelines like that, they look at the totality of the literature. They look at the totality of what other societies and colleges and have recommended, and they come out with recommendations based on all that. You can't take one article that supports one stance and say,
One,
well,
no,
that article says that it's okay. No, that's not
no,
how that's
that's
not
how it
how
works.
science and medicine works. That's not evidence. And I hear it all the time. Well, this article said that, so it's evidence based because I got it off the bed. No,
No,
evidence
that's
based
yeah,
means you take provider experience,
everything.
everything, and have. That's why we need AAP. That's why we need ACOG. And so we need all these societies because they put everything together. They have the people to do that and come out with recommendations. And the recommendations are to sleep on the back and not co-sleep. But I know that it happens. Just do it as safely as possible. And I'm not here to judge anybody, but we just want everybody
Yeah,
to have healthy babies. So we won't go into, like you said, that's a whole nother
it's a
thing.
whole
But
different topic
so
though.
what do you think about the DACA and the Moses basket? What do you think about those?
So the Moses basket, I mean, Abe even said it's a little bit unstable. It's fancy, can look, but it's a little bit unstable only because the stands are not stable. But then the other thing they mentioned is if you want to use a Moses basket, you can find the one that has like really sturdy legs. So that way your baby doesn't tip because the concern is it's like fancy and rocking until it's not. You turn around and
Yeah.
then it flips over and your baby's on the floor. So if you want that, make sure you're looking for one that has sturdy legs that can adequately balance your baby's bassinet or make sure your baby is sleeping comfortably and safely.
Mm-hmm.
When it comes to DockATot, I think recently they've changed the name. Before it was supposed to be a sleeper. It's not. They made it sound like it's something your baby can sleep in and be there. It's not.
Mm-hmm.
DockATot is not supposed to be on the bed. There's nothing supposed to make you crib because I've seen a lot of people put a DockATot and then put it in a crib and say it's supposed to solve the problem. It's not. I kind of see it as things maybe you want to put by the side when you're awake and watching your baby because you want
Yes.
something that guards on
Yes.
the side. That way
Yes.
you're sitting in the living room having a conversation with your friend, but you don't want to carry your baby. So you just want the baby to lay there, maybe kicking their legs and something like that on the side. But it should not be something your baby should be sleeping in, especially one when you're sleepy too, and when there's
Yeah.
no one supervising it because it's just too risky.
Yeah. Yeah. Gotcha. Okay. Now, swaddling. Uh, what say you? Is it a good thing? Is it a bad thing? And what is your reason for your answer?
So
Swaddling.
swaddling is actually a good thing if you can figure it out because I feel like
Right.
not everyone.
My son was all about and my daughter, she got that one arm out
Yeah,
all the time. She could not have it. She had it.
that's the thing. So if you can figure it out, actually,
Yeah.
I was so terrible with my first one, but the nurses and like the labor nurses and NICU nurses, they taught me how to make a baby burrito. They are so good.
Oh,
So
that's
if you
how
can
I
figure it
learned.
out,
Yeah, that's how because they were in the NICU. I learned how to swaddle good.
Yeah. So
Yeah.
if you can figure it out, swaddling is good only because it mirrors the position when the baby is still in the womb and the comfortable location. It makes them sleep. Can also help them soothe when it comes to colic. So it's good. But what you want to make sure is once your baby starts to wiggle around or show signs of like rolling or trying to tip, then you want to start weaning it off, meaning you want to either swaddle with one hand out, both arms out, and then wean them off. So the reasons are, like we mentioned before about safe sleep. If your baby rolls and flips on the belly and there's no arm or like fingers to push them
But
off the
yeah.
bed,
Mm-hmm.
so they get stuck and they're at risk of getting of suffocating too. Or the blanket or the swaddle may just be loose all completely, and then you end up finding your baby, you want them tied around the arm or around the head, and that's not safe too.
Mm-hmm.
So when there's any chance your baby is starting to roll or moving their head, just stop
Yeah.
swaddling.
Yeah. 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 Um, yeah, I was very good at swallowing it. It didn't last for very long though with mine, especially my son. He was not always a fan, but yeah, I went through I bought all the fancy swaddles and honestly the cheapest one was the best one. It really was. They
I know.
always
But you know
are. The
what?
cheapest one's the best
But you
one.
know what it is? That when you're having a baby, you go for the most expensive
You
one. Like
gotta try
why?
everything.
What? Yeah.
Gotta try everything.
But yeah.
Okay. So here's another good question. What to wear? We act like, we gotta go through
Oh,
the whole fashion thing. So I I was very simple. I wanted them in a onesie, and what I opted to do was keep the house temperature cool. I live in Texas. We don't have a lot of cold months, and I wanted them to sleep. Is it true that sleeping with a cooler temperature is also beneficial for babies?
yeah. So
Yeah.
I can't remember what study said that, but it actually helps decrease the chances of SIDS too,
Yeah, yeah.
because you're not
So
too hot and all that.
yeah,
Yeah.
yeah. So I always kept them simple. When they're really little, I might have kept their little cap on, because they do lose heat through their heads. But I kept the house cool as opposed to keeping them without any clothes, and then I just had them on in a onesie. I felt that was easiest for me and what I felt comfortable with. But are there any magic guidelines regarding what a baby should wear, a newborn should wear?
So I think, like you mentioned, you always want to go based on the inside house temperature
Yeah.
and not the outside, because people make a mistake of,
Yes.
oh, it's snowing outside and it's like winter outside,
Yes.
and they
Yes.
dress them in like heavy blankets.
Yes.
The
Yes.
baby is going to be too hot and it's going to make them uncomfortable. One, they may not be able to
Yeah.
sleep, and two, also increases their chances of like SIDS. So definitely go with the inside house temperature. And there's actually something called TOG, which is thermal overall grade, and it's
Mm.
typically on all the clothes. So that kind of gives you an idea of what layer should your child be wearing. So like now in the summer when it's hot, you want to make sure they're just wearing like what you mentioned, the onesies. They don't need all like the blankets and all that.
Mm-hmm.
And you go from like zero point 0.5 tall grade to like 2.5. 0.5 is when it's like summer. And then maybe towards the end of like let's say probably like September, you're going to like tog 1, and
Mm.
then gradually increase it to 2.5 when it becomes winter and maybe when you're going out. So when you
Mm.
take a look at the clothes of babies, always look out for that tog options based on the temperature in the house and based on the weather when you're going
Where
out.
where can you get that? I've never heard of that. Where can you get the tog? Where like how could
It's
they people?
it's on the clothes. Actually, I'm trying to figure out what website that explains that completely. I can send you the link, but
Yeah,
it's
yeah.
called TOG, and it's typically should be written on all the clothes
Hmm. Oh, it's
to
on the
explain
clothes.
on the,
Okay.
yeah, on the clothes. It should be on the clothes. But then for you to
Uh,
tell which one is for which weather,
yeah. Yeah, okay.
there's a website I can send to you for that to figure
Yeah,
that
yeah,
out.
yeah, yeah. Well,
Because it
I'll
makes
look
it
it up.
easier to be able
Yeah,
to
yeah.
choose. Yeah.
I never heard of that.
Yeah.
Okay, we already talked about the poop things. Okay, wait. There's actually okay. Sick. Now, yeah, yeah. I think COVID has given most of us a little bit of break where we haven't been exposed to as many viral illnesses. I know this is the longest time I've ever went without virus. Before then, I was sick with everything that the twins got, and they were sick all the time too. But how do you know when to call the doc? I when they're newborns and they're stuffed up and you are convinced they're suffocating and then they have a fever and it's scary. So like when do you make that? How do you know when to let the pediatrician know that something's going on or when to take them into urgent care?
So when it comes to newborns, once they have a fever, anything 100.4, you should be calling your pediatrician.
Okay.
Only because they cannot regulate their body system yet. The fever can start with one place and they go what we call septic and it just becomes generalized. So unfortunately, any baby with the fever 100.4, you have to talk to your pediatrician. But
Okay, wait,
also,
I'm going to stop you for a second. What's the best way? the most accurate way to take the baby's temperature?
Rectally. The regular old thermometer rectally. That's the most accurate way. And then also, besides having 100.4, if your baby is going towards 95 degrees Fahrenheit, that's also considered hypothermic because they're not regulating their temperature correctly. And that can also, that might mean an infection going on. So we're not only looking at the fever, we're also looking at being hypothermic when it comes to babies. So outside of the fevers, babies sneeze a lot, have a lot of hiccups, and make a lot of grunty noises. So you want to make sure this is not like the typical baby noises that you may want to ask your pediatrician which one is weak during the first visit.
Yeah.
But outside that, babies get congested a lot. One, because when they feed, some have reflux, and then when they have the reflux, the formula can go to the back of their nose and kind of get stuck.
Yeah.
So that might seem like it's like a virus coming up, or maybe they're congested. It may just be like a mucus plug from the milk. So you want to make sure you're suctioning them. But now, because there's a lot of RSV going, this time is a little bit different. If your baby has any runny nose and is a newborn, I would recommend them getting seen by the pediatrician, only because newborn with RSV tend to be apneic. With me, which means they stop breathing for a few minutes. Yeah, so you want to make sure they're getting checked. But if it's not during the viral season, they may have congestion. The bulb suction works great, unless you're starting to notice they're not feeding, they're more fussy, they're vomiting. Then you want to get them seen immediately.
And talk. I mean, we can't really show it here, but you can Google it. What is it? The special type of breathing they have? Is it called when they're retracting? Yeah. What's it called? When they're they're breathing and you see that they're
retractions.
Is it retractions?
Yes.
A lot of people miss that, and it is a significant sign that the baby's having trouble breathing. Explain what that means and what it looks like.
So, one, because babies are obligate nose breathers, which means they cannot breathe with their mouth. If they're congested, they can't breathe. So after a while, they're trying to work up pressure to breathe against all the congestion going on. So that means what we call the belly starts tugging in. So you can notice them, all their ribs are going in and out, their belly is going in and out. In the initial stages, the baby might just be comfortable and smiling, but because over time they get worked up and get tired. You want to always watch out for that. So even if your baby is still smiling, as long as it's seeing those retractions of their ribs going in and out, that's what's concerning for retraction. Or you're seeing their noses, what we call flaring, which is going in and out. That's also concerning for being in distress, and you want to get them checked out.
Yeah, so you can Google retraction or baby breathing with retractions, and it's very distinctive, and you can tell. Yeah. And once you see it, you probably won't forget it. And also Google what it means when their nose is flaring. And so, there's videos there where I'm sure you could find one to see what it looks like. So that's what I would recommend.
There was one I recently did a duet on about the abdominal breathing, so I can send that to you if you want to add that. Yeah.
Well, it's on your
it's on the TikTok.
It's on your TikTok. Yeah. So go to Dr. Orajiaka's TikTok. She has great videos about all of these things that we're talking about, and you could see what she's talking about along with it, which makes it easier. So I do recommend you guys do that. Okay, let's talk a little bit about feeding. Washing bottles and sterilizing. Is it really necessary to sterilize your bottles after every feed?
That was before. Not as much, because one, it's I think as long as you're not like putting the bottle through mud, you don't always have to sterilize with every feed. You can sterilize at the end of the day. And then use it again from the beginning of the only because the risk of infection is not as high again compared to like sterilized wood. That's why they don't recommend sterilized wood feed, because also we notice that it's exhausting for like a parent who's trying to get some rest and feed and take care of the baby to sterilize with every bottle. So we always recommend it's okay to just kind of sterilize towards the end of the day when you're done with the whole feed, and you can do that.
Yeah. And I think that's also important, just to not let any residual milk or anything sit in there. It's just rinse them off. Rinse them off with warm water and turn them upside down. Make sure it's straining out. That's what I did. I didn't sterilize the bottles all the time. I just made sure I kept them rinsed out. So it wouldn't collect in there. Yeah. What about pacifiers? I remember I was so obsessed with cleaning them. As soon as it hit the ground, I was like, running it into but now by like 5 or 6 months I was like why wipe it off. And I'm
So
assuming it was okay because they're okay, but was I being a bad mom?
I guess when it comes to so pacifiers, I still recommend washing it out. I think one of the things I always tell parents not to do is using your mouth to
To clean
wipe
it.
the pacifier.
Yeah.
That's like a no-no, only
Yeah.
because the bacteria and stuff in our mouth is not, you're going to pass it on to your child, and that can
Yeah.
actually get them sick. So
Yeah.
it's okay to use if you have like a cloth, maybe you're in transit and maybe going somewhere, you can wipe it out with the cloth you're
Yeah.
holding,
Yeah.
or maybe rinse it out to wash it up, but not in your mouth. Like that's
Yeah.
one that people don't always like believe, but it's not recommended to use your mouth to wash that out.
Yeah, and it's even to this day, and it's for other reasons. My twins are almost 5. I still don't kiss them on the mouth, or I still ask permission because I
Yeah,
want them to understand boundaries. And I say,
yeah,
"Can I kiss you?" And I'll kiss them on the cheek. Whatever. But
yeah.
especially when they were little, I was very, very conscientious about that. Maybe a little bit too much, but that was just something that was important to me. But yeah, I didn't want, and I never put anything in my mouth, and even hardly today we hardly ever share anything because you don't know. I mean, first you don't
You
want
don't
to pass
know.
something around everybody. You already have a
Yeah,
high chance of doing that anyway, just being in the same household. I don't want to
yeah,
inoculate everybody with the
yeah,
sick germs. So,
yeah.
yeah.
And I always
Um,
recommend, especially for newborns, so if you have visitors or you're like your
yes.
parents,
Yes.
always let
Yeah.
them know, one, you don't want anyone kissing your newborn,
Yeah.
especially in the
Yeah.
mouth, because like
Yes.
we have like
Yes.
herpes and like
Yes.
other viruses that can be transmitted. You're not being a bad parent. You're
Anywhere
just
around here.
caring for your
Yes.
child. Yes.
Yeah. I was very, very, very strict about that. No kissing anywhere. Actually, we could cuddle, whatever, but just no,
Yeah,
we have a lot of dirt and germs in our mouth.
we do.
Yeah, and they're little. They don't have an immune system, and it's just not worth it.
Yeah.
What about the supplements? You hear, I love social media. I do, but sometimes I just want to yeah, because you hear of all the supplements and all the things that the people are giving their babies and these concoctions and all this. This is what your newborn needs. And what do you say about that? I mean, how do you know when to draw the line, or are supplements necessary?
So, the only supplement that we recommend for babies who are breastfed is vitamin D. That's the only thing we recommend. Only because I think studies have noticed over time, one, because we're always inside, you're not getting enough
Not
vitamin D.
getting
So only for breastfed babies, and even for that, I think the recorded case of rickets has been a long time going. So we still tell, like when I was in clinic, we used to tell parents, give vitamin D, but this is not something you stress yourself out like, oh, I
yeah.
missed one dose, I'm a parent, I don't know what to do. It's okay to give. But when you're formula fed, you don't not necessarily need vitamin D or any other supplements, only because the baby is getting enough of what they need from the feeds, from the parent, from the formula. So you don't really need that. Even when they're older, unless your baby has any medical problems, any chronic medical problems, I do not discuss supplements. I don't even recommend, only because there's a million in the market. You can stay on the aisle of
Yes.
supplements and get confused. You're like, oh, do I give this versus that? And essential oils, no, I don't even discuss that at all. But it's
Mm-mm.
just a whole lot. As long as your baby is getting a balance when they start feeding, a good enough balanced diet, that's enough to give them all they need, unless they have a chronic medical problem, which I
Yeah.
haven't lost for.
Yeah, yeah.
So that's
I
what with the
agree. I
supplements.
agree. Yeah,
Yeah,
the supplements and the supplement and I've talked about this before. It's not a regulated industry. You don't even
it's
know what you're putting to your own body, much less that of
yeah.
a newborn, infant, toddler. It's just, unless there's a medical reason to do that and it's under a doctor's supervision, you just kind of stay away from that. Okay, let's get into baby proofing. That was, it's one of the things that you, as a new parent, you're constantly thinking about all the traps that the babies can get into. And I mean, and I was very, very, another thing, source of stress was to make sure there was nothing they could hurt themselves with. We've already talked a little bit about the crib. Anchoring furniture. There was a video that is horrific. You could see it's going to happen, of the twins that were playing in the room. They were probably
Oh
2,
yeah.
and the
Oh yeah.
dresser falls over. It just so happened that it fell over, and the
One.
drawer fell out, and it landed right on the other side of the one toddler, and he was protected by
Yeah,
that. It was just like you hold your breath like, and
I know.
thankfully it didn't happen.
Yeah.
So why do we have to anchor that furniture?
So just exactly what you explained, it can fall at any time. One, because kids, are very curious. They are climbers. They can do like anything is exciting to them. So they're not. I saw someone on Instagram, TikTok, like kids within the first 5 years are always trying to kill themselves. So that's what
Yes.
it is.
Yeah.
So it's just a curiosity. They want to reach that thing on top. They're trying to get into
Yeah.
the cabinet, trying to get into every single thing. So it's just about us being ahead of them by anchoring, because you don't want those things to happen. As long as, I mean, we usually say as long as it's higher than 3 feet, but as long as any furniture is heavy,
Mm-hmm.
you want to anchor it, because then you might think the one that's 3 feet or less wouldn't fall on them. They will still climb and then it tips over. So it's all that tip over inches, which we see a lot in the emergency room. That's what
Yeah.
you're trying to avoid. And
Well, I
so we're
mean, the
talking
other
about
thing,
like,
yeah, and well, the other thing is that if it falls on them, even if it's not, that may not be heavy, it could be a positional thing to where they get stuck in a certain position to
stuck.
where they can't breathe. And you have to
Yes.
think about that too, that it may not, you think about the trauma and hitting the head, but it's not only that. If they get trapped
Yeah.
and they're trapped in a certain position to where they can't breathe and they're not able to get them out, that could cause them to suffocate, right?
Yes,
Yeah,
definitely. And
yeah,
there's
yeah.
a really good website called anchorage.gov. It
Mhm.
shows you videos of things that have happened
Yeah,
before. It shows you ways to anchor. You can
yeah,
also call baby proofing people to do it for you, but this
yeah,
is like a cheap way to keep your child safe. It's so
yeah,
much
yeah,
cheaper
yeah, yeah.
than going through the hassle of like and the distraught of injuries too.
Yeah, yeah, yeah. What about teething necklaces? I've heard pros and cons. I never use them because anything that I put around the neck, I was not a fan of, even if it was for
Yeah.
teething. What are your thoughts?
It's a no for me.
Yeah,
It is a
yeah,
no, because yeah, the strangulation risk is so high, because
yeah.
one, you may just put it on your baby because they're running around. You can see them, but babies can go between running around to
Yes,
passing out somewhere to
yes,
sleep. And
yes,
it's just that
yes.
it's just about that 1 second before something happens.
Hmm.
The teething rings they can hold, the regular cold washcloth
Yeah.
in their mouth, those are easier for them to hold. Amber necklaces, necklaces, I mean, I'm not sure how much. I haven't really checked how much they are, but it's not worth the
It's
risk.
not worth it.
You
Yeah,
don't
I
need
agree.
them, no.
And then one that we hear about all the time, button batteries. How, first of all, how do they get them? Because it's not like people have button batteries, or most of us don't have them laying around. So where are they getting them from?
So unfortunately, there's so many things in our homes that have button bar, like the
Yeah.
remote control, the
Yep.
fob key, our key, like what do you
Hmm.
call our car keys, the thermometers, all those toys they have that has like a battery in the back, it may fall off, and that happens.
Hmm.
Hearing aids,
Yeah.
greeting cards that you've used
Yeah.
before. So many places in our homes have button batteries. So, and this, you may not necessarily be thinking, oh, I mean, I don't have to work because I didn't put any button battery on the floor, but things may fall off, and that's how they get it. And remember, kids or babies always do hand to mouth. So
Hmm.
the first place things go is into the mouth, because that's their way of exploring. They're
Hmm.
not doing it because they want to hurt themselves. They're just
Yeah.
doing it
Yeah.
because they want to explore and know what will happen when I swallow this.
Yeah.
And
Yeah.
they're one of the most dangerous things ever.
Hmm. And you also hear a lot about magnets, them swallowing magnets, and the magnets getting stuck in the intestines.
Stop.
Is that a real thing?
It is a real thing. Yes, it
Hmm.
is such a real thing. I think one of the ones which we're having a really big issue with now is something called the Zen magnets, or like buckyballs. It's
Mm.
They're earth magnets. They're colorful. They're fancy, and I think it's usually marketed for like kids or for teens and adults for like stress relief, because you see them magnetized and it's so fun. But it's so colorful that babies always thinks it's they always think it's candy, and they swallow
Yeah.
a
Okay.
whole bunch of them. So it gets magnetized together. So you may have your intestine or their belly in between, and it gets magnetized together, and it can erode, which means it can tear completely. And there've been so many kids who have been in the ER who need their intestine removed just because of those magnets.
Yeah.
And I
Yeah.
think another thing I would recommend checking is, like the fridge magnets, the alphabet ones.
Yes.
Make sure when you get the fridge magnets, get the ones that have the magnets not exposed. So the magnets are inside, so you cannot see. Because some of them, I see one that you can see the magnets in front. I mean,
Hmm.
no,
Yeah.
the alphabets in front and then the magnets behind. Don't use those. Use the ones that have the magnet completely covered.
Yeah. And the weird thing is they will find it. I
Yeah.
don't know how they do. Kids will find a thing that you did not think of. They will find it, and then you will realize, oh, how did I think of that? They will always find one thing that you
They're
missed.
always, yeah.
So You just kind of always, I just, wherever they were, I would just constantly scan. Is there anything in the vicinity that they can get a hold of? And I better go grab it. I remember one time they loved the door stoppers. You know, the door stoppers, they loved to hit them and they made that sound. They loved it, but of course they found a way to take that sucker apart. And the
Oh my
very
God.
end came off. And guess what? One of them was like, and I mean, and it would keep them busy until everyone was, oh my gosh, they're going to swallow it. And then
Yeah.
there with the door stoppers. So, I guess
Yeah.
the moral of the story is always watch what they're doing. And then you can
Yeah.
kind of figure out what's dangerous
I
because you'll see them.
know.
They just take everything apart.
Yeah. But I
Okay.
just wanted to say, I think
Yeah.
another thing is doing the best you can as a parent,
Yes.
just proofing the most you can.
Yeah.
But
Yeah.
don't let it make you all very anxious and
Yes.
concerned.
Yes.
Because another thing is, I have a lot of parents who end up in the ED because they're like, I did everything, but then my
So,
kids still hurt
yeah.
themselves. And that's okay.
Yeah. Yeah.
We
Yeah.
will still take care of them. Things still happen, but you just have to do the best you can with respect to like proofing and just keeping them safe.
Yeah. Yeah. No, I mean, and it's you can't stress yourself out too much. I as particular as I was, my daughter said stitches twice. I mean, and it happens.
Yeah.
It's going to happen to
It's gonna
them.
happen.
And
Yeah.
yeah, she's been in the ER for multiple times because her bigger brother has, put his heel in her eyeball. I mean, it happens. It happens. But
It still
we can,
happens. Yeah.
yeah. There's just certain things we can do to make it a little bit
Exactly.
safer for them. And then we definitely need to talk about laundry pods and cleaning products.
Okay.
We tell us about that. The laundry pods are in cute little packages. They're colorful. They're going to be attracted to that, and you definitely don't want them eating laundry pods. What's the danger in that?
So because it has a lot of chemical
Okay.
content, one, and it's not just even about eating them. I think what I've noticed that some kids do is even when they get older, they like to squeeze on them. So even
Yeah.
getting in contact with their eyes is a little
Yes.
bit, it's so dangerous too.
Hmm.
So I know that the company that makes them is trying to make it all protective and the seals. The best way is just to make sure it's not underneath. Always keep it high
Up
up
high.
in
Yeah.
locked cabinets, or make sure one has not fallen off, because what they do is pop in the mouth, try to
Yep.
squeeze it out. So that's
Yep.
what it is. And
Hmm.
as long as the company even try to make it safer, you just have to choose your own safety and make
Hmm.
sure it's not available for them. Because it has a lot of contents, can go from a
Yeah.
0 to 100 when it comes to babies. It's super
Wow.
dangerous too.
Yeah, and we still have our anything that's under this, the sinks where we put our, cleaning products. We still have that under to where they can't get into it because they're 5
Yeah.
and you would think they know better, but you never know. They just started writing on the walls. They never did before. Never. And within the past couple of months, almost every one of my walls has been marked up on, and I don't know why, because they're 5, and they should definitely know better. But
Gosh, kids are so cute.
they do what they're gonna do.
They do.
Okay, what else did I want to ask you about? Here's another good one. Uh, you've heard a lot about, and you hear a lot about on the news about babies inadvertently coming into contact with drugs. And this is not going to be a conversation about judging parents who do partake in that, but it happens. And even as safe as you think you might be, marijuana, brownies, other types of illicit drugs, babies, kids can get a hold of it. How do we protect them from that? We cannot assume that they're going to be safe. And something we think is benign as marijuana brownies is still dangerous to them, right?
Yes. So I actually did a post on 4th of July about marijuana
Oh,
brownies only
okay.
because we recently saw it in the ED. And it's just a snack. The babies will always see it as a snack.
Yeah.
And yes, it's for the parents, it's like prescription medication, is what they're
Mm-hmm.
supposed to take, but you're not supposed to allow the baby to see it. And I think what happens is, one, maybe you brought it out, I just want to take a quick one and let me go do something else. I'll put it back later. And there may never be that opportunity for later because one, they may eat a little bit or they may eat enough to get them so what we call in coma or really hurt them.
Mm-hmm.
So yes, medications, you always have to have a lockbox and put it away. Once you take one out, it may be an extra 2 to 3 minutes, but it always saves you and your household and your child the chances of getting for them getting into the medication. Another common one are the purses. Like you have a visitor who shows up to the house and the
Mm-hmm.
babies, they don't care who's, they're just getting into every single thing. They get into the purse, they think it's candy.
Mm-hmm.
It's like they're snapping through the medication and popping into the
Right.
mouth.
Yeah.
So I always recommend make sure the purses are not just hanging on the table.
Yeah.
It's like
Yeah.
out in like a high closet where they cannot reach. And of course, like other medications, like there's always this thing about what medication looks like candy versus which one
Yeah.
does not, regardless of what the
Does it
color of the
matter?
medication is. It
Yeah.
doesn't matter. It
Yeah.
doesn't
Does
matter because
matter.
they want
Mm-hmm.
to try the white one that tastes really bad. They want to know what it tastes like. And of course, like ashtrays too, like marijuana ashtrays,
Yeah. Yeah.
make sure you take them out because they will get into it. And I mean, we see just a whole lot of kids getting into drugs, and I know it's hard. I mean, there's no judgment, but you just want to try your best to know if this is for me, it is for me, then I want to protect it
Mm-hmm.
and know that my child will be curious enough to want to go try that and know what it is. And they
Yeah.
can go
Yeah.
again from a 0 to 100.
Yeah, yeah, yeah. And then the last thing, this is more for those that once they start crawling and pulling up, is any kind of a chest, a washing machine, a dryer, anything they can open and then close themselves into, anything, a cooler, a drawer. I mean, some of the drawers in my house are actually very deep. And, you know, getting in there, I was worried about them getting in there. And we also have the self-closing drawers, which is more unlikely because they're a little bit heavy, but I'm not saying it couldn't happen. So anything like
Yeah.
that that they can get in and you know, potentially suffocate in. We do have two trunks, one in each one of the rooms, but we put it under lock and key so they couldn't get in it without us knowing. But
Yeah.
what recommendations do you have for stuff like that, and the washing machines and the dryers or anything out back? I hear all the time that there was an old, I don't know, chest or an
Chest.
old washer in the backyard, and a child find their way into that. What do we need to do with those types of to prevent those types of accidents?
So lock it up wherever the
Yeah,
chest or the dryer
yeah,
is, you lock it up. If you don't use the chest or you don't need it, you can actually take it out. We over the years have started recommending toy bins
yeah,
because the kids cannot fall into, I mean, it's going to be a small one. Even if they fall, they can fall out of
yeah,
a toy bin. But the chest, they can get stuck, it can slam on their fingers and hurt them. So
yeah.
you want to eliminate the, or just lock the doors completely.
Mm-hmm.
Like other ones like you mentioned are like cabinets that pull out. Of course, we always
Mm,
recommend as part of child proofing, latch the
yeah.
cabinets in the kitchen because we're, I mean, they can like to pull the pots out, but the spices are another one that babies can get
Mm.
into,
Oh, that's true.
especially if your spices are lower down and not on top.
Mm.
We've had like kids get into cinnamon and
Mm.
nutmeg, which was a challenge before in TikTok. But those are dangerous spices too. They can get into, make sure your spices are not underneath. Just always latch
Mm.
them so they don't know how to open the lock.
Mm-hmm. Mm-hmm. Okay, let me see if there's any questions. We have about 5 minutes left. Let's see. Any questions? Let's see. We got a cold at a hospital. My newborn is 1.5 weeks old. Anything I can do other than nurse and saline? I'm guessing for the congestion.
Yeah, it would just be the same thing. You can nurse and suction and saline, and you can try to aim to suction before feeds and
Mm.
before they go to bed, because if they're very congested, they have a less likelihood of wanting to feed because they're trying to breathe at the same time and at the same time feed. So what happens is if they're very congested and then feed, they end up coughing and vomiting. So
Mm.
we always recommend try to suction before you feed your baby. They don't like the suction because everyone is like trying to fight you, but
Mm-hmm.
just that usually gives them some relief. And then before you put them to bed at night,
Mm.
suction them really well so they can breathe and get a good night's sleep too.
Yeah, and then since we're talking about that, one of the lives I did was on with a doc who is a pediatric NT that
Um,
developed the Nosebot,
yes.
Nozebot. I didn't get, I haven't got to try it. I have one, but I didn't get to try it because my kids are older. But it looks to be like a pretty decent product. But there are other things that you can do to help suction the nose. But that's important. I know they hate it, but
Yeah.
we got to keep
They feel
them.
so much better
They
after
feel
that
better.
though.
Yeah, 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 yeah. Okay, well, that is all the questions that I have. I thank you so much for joining me. It's always a pleasure. Please go to Dr. Orajiaka's TikTok, Dr. underscore how do you,
A
sorry,
A.
Orajiaka.
Yeah,
And
yeah,
I'll put
with
it
a
on in the caption over here. And it's the same
yeah.
here on Instagram, but I will put her Instagram account here, and then you could just go to there to go to the TikTok and everything.
Yeah.
Thank you so much. I
Nice
appreciate
chatting with
you.
you.
We'll get
Yeah.
together soon. Have a great rest of your weekend. Thank you so much for sharing all of
You too.
your knowledge and wisdom.
Bye. Thanks for having me.
Thank you. Bye bye.
Okay, bye.